There it is.
Yeah, I got a few of those. They actually won't give them to her anymore,
Really?
so I kept the old ones. They'll still work.
Oh, yeah.
Just not as good.
Yeah.
Because it wasn't really an allergy reaction, but they also won't test her. They won't even do a skin test on her.
Because of the potential issues that,
Yeah, because of how easily
Yeah.
they could trigger.
yeah, they're like, we don't want that to happen.
Right, it's not worth the risk.
Right.
And she was, like I said, she was sick for, I mean, months. And months.
All right, everybody. Good morning. Happy Monday. Happy time change. Man, gotta love that. Okay, I was always setting an alarm because what if I don't wake up? But I always wake up. And last night I'm like, I better turn this alarm on. I still woke up, but I'm like, darn it. Not so good. Okay. Then I'm like, what? First off, there's so many questions. I'm like, why? Why do we even have to do it? We don't need to even go into that. But I'm like, why couldn't we do it to start on Saturday so that then you've got 2 days to deal with it, and then here we are. Wouldn't that be better? I think so. Whatever. That's got something to do with the bars, I'm sure. They're like, nope, we're not doing a time change, not on a Saturday. All right, it all makes sense. So we've got one chapter left. There's technically quite a bit of stuff in here, but my intentions are to lecture today and on Wednesday. The test opens Wednesday after lecture, and my hopes are that we get all of that stuff wrapped up, so there will be no class Friday, which I assume lots of people want to start spring break yesterday. We've talked about all sorts of details with the immune response. We've been thinking about how things function properly as we've moved along with these chapters. Now we want to start thinking about some potential issues. What happens when things don't function like they truly should? There are all sorts of different possibilities as far as how an immune response could potentially combat ourselves one way or another. So we want to think about all sorts of different possibilities. We'll talk about some autoimmune diseases and other diseases and disorders as we progress along. We'll think about things like blood transfusions and others as we move through. So there are numerous types of allergic reactions or types of allergies. We've talked a little bit about some of that stuff. We showed a primary and secondary immune response. Talked a little bit. Stepped on this wire and I'm like, don't step on that thing. There could be issues. I made the screen all messed up, I think. Don't step on cords. So issues with this. We think about all sorts of potentials that can result. Some people may say they are severely or deathly allergic to things like bee stings or maybe peanuts. And as a result, we oftentimes see opportunities for things like EpiPen, the epinephrine, can be given to these individuals basically if they go into a serious allergic reaction, what we call anaphylactic shock. It's not the same, but it always, whenever I think about this and the EpiPen, I flash back to Pulp Fiction. If you haven't seen that, doggone it, that should be your homework. That's good stuff. Not the same, but pretty impressive. I think it's an EpiPen that's stabbed into her. I'll leave it at that. So every time I see this image with these pollen grains, you just flat out know that sucker's going to make some issues in some people. It begs the question why it doesn't drill everybody. as we look at this, these pollen grains, and they are, to me, as I look at this image, I'm like, oh, those are beautiful. I look at lots of things through the microscope and I'm like, oh man, except for like bacteria. I'm like, that doesn't really do it unless it's an electron micrograph. There are all sorts of potentials, and there are possibilities for you to visualize some of this. If you were like looking at a fecal smear and dependent upon what you may have had for dinner, you may see a plethora of things like this, and that makes it also more difficult to truly kind of weed through all of the nonsense to figure out what's ultimately happening. Pollen grains are definitely impressive. We could see some skin reactions, some rashes, maybe hive-like reactions on the back of this individual, maybe from something like this. Just depends on the respective allergen. Peanuts, also a potential for some serious allergies. And I think it's pretty interesting. I think it, with a lot of this stuff, it kind of depends on where you're at as far as, do these things really cause issues? Are they problems or not? All right. We will mention a hygiene hypothesis in the next slide or two. I think it is crazy to think about. And where we are in the United States with access to all sorts of healthcare and going to the supermarket and being bombarded with an aisle full of all sorts of cleaning agents potentially sets the stage for problems. Not that you should live in filth, because you shouldn't. There are some benefits to playing in the dirt, all right? Definitely. And we'll come back to that here in a moment. So with this, and we talked about this before, but we didn't really show the details as far as what was going on. This was more of that image with the primary and secondary response, showing how those levels of antibodies start off relatively low, and then upon a second exposure, we see a big response, that primary and secondary, or a sensitizing and shocking dose if we're talking about allergies, all right? Same, but slightly different. And the different stuff is really this up here. The specific B cells that can be tasked to produce things we think about in a normal, maybe healthy immune response. IgM and IgG are the main ones. IgM first, IgG second, and they're the ones that you really are hoping are the responders, if you will. But we can tell some other stuff based off of some of these epitopes, back to some of this stuff, maybe, as we look at these spikes on these pollen grains. Some of these things can stimulate other classes of immunoglobulins to be secreted from these B cells. So the same deal. So first exposure, we process it, we present, and in this case, secreting some of these cytokines, stimulating other cells, all of this stuff, normal situation, all right? But some of these B cells, instead of producing the IgG or IgM, now we start going this route. So releasing these interleukins, cytokines, the B cells proliferate, and they start secreting these antibodies that are extremely elevated when we think about allergic responses. And they help to facilitate the real deal when we think about types of allergic reactions. The IgE molecules secreted from the B cells link up to and bind to the mast cells. As we see here, the little tail of the immunoglobulin, the FC region, is what links up to receptors on those mast cells. They snag the IgE immunoglobulins, and it stimulates the mast cell. That mast cell starts pumping out massive amounts of inflammatory mediators, histamine and others. Part of that helps to stimulate a response, but when we think about an allergic reaction, it's an overstimulation, and we see potentially serious effects. We flip it back to the bee sting or other. So hang on one second. Stop sharing. New. I'm like, I don't think these tables are in there, but they should be. So this figure in the text, this is what we just looked at. So right above that, a couple of tables that are talking about what our mast cells are harboring. In the first place, we've talked about histamine, but heparin and serotonin are other granule components that we can see that these mast cells start spewing out. So the histamine causes smooth muscle contraction. It increases the vascular permeability. That's what helps those immune cells, stuff like neutrophils, to move out of the vessels and into the tissues. We showed that stuff, I don't know, a chapter or two back in the diapedesis, as these cells basically just kind of move right through there, right? We can also see increased mucus and tear formation. And if you've got allergies or hay fever, you know this type of stuff. You get very plugged up, eyes are really watery, lots of mucus, and histamine is a huge player in that. The heparin up above, we stimulate bradykinin. We see more vascular permeability. These guys are all acting together. Vasodilation, increasing the blood flow, bronchial constriction, and increasing mucus, right? Serotonin, similar with the vascular permeability, dilation, and smooth muscle contraction. All of these lending to ill effects when we start dumping mass quantities, right? And other mediators with in the inflammatory and or allergic reactions, more cytokines. So leukotriene, prostaglandin, and the tumor necrosis factor, similar as above with muscle contractions and vasodilation. So I think that's probably it. So there's my hygiene hypothesis as well. I'm just going to scroll down since I'm sharing this right now, because I don't think this table is in the PowerPoint as well. So as we are going to shift from just this introductory, we'll want to think about a handful of different types of hypersensitivity reactions. A stimulation that is, in this case, like allergic reaction, or other immune response where it's a little bit messed up, all right, one way or the other. So I think, you know, except for the anaphylaxis, if, you know, this would be like the more mild type of all of these hypersensitivity reactions we're going to think about in this chapter, all right? A little bit of hay fever, probably not that big of a deal compared to some of the stuff we're going to introduce here in a second, all right? So there are all sorts of different possibilities with these type 1 hypersensitivities, right? Allergies, hay fevers, the hives, those rash-like guy we saw a picture of a couple of slides back, all of these different types of type 1 hypersensitivity reactions. And we'll go through and look at the details, the mechanisms behind this in a second, all right? So the pollen grains, all right, that we just showed, or other stuff, dust, can have all sorts of allergens. Some of that is like the feces of dust mites that can be allergenic, so can their exoskeletons. Those are awesome things to look at through like an electron microscope. You'll be like, what in the heck? That's in my house? What? Impressive. So similar, as we move through here, this would go back to those mast cells and what they're releasing. As we see some of the signs and symptoms, it fits with what we just described. The anaphylaxis is a systemic reaction. This is where that EpiPen would be warranted in those circumstances, all right? All right, I'm going to stop with that. Go back to this. So, oh, now I'm going right into the transfusion reactions. That's type 2 hypersensitivities. I thought, for some reason, I thought my hygiene hypothesis was in this PowerPoint. Whatever. Not going back to the book right now. I'm going to stop. I'm going to back it up. I'm going to talk about hygiene hypothesis for just 1 second, because it's what we want to think about with the type 1s and allergies. But with that said, we technically could think about it with some other stuff as well. All right. And I think it's really pretty impressive. All right. There are all sorts of ideas, and we've hinted at some of this stuff as we've progressed through. And definitely this morning, I'm a little bit like, playing in the dirt. Maybe that's good for you. There are all sorts of ideas when we look at like individuals in the United States, and then we potentially look at people elsewhere, maybe in a developing nation, where we can see different types of infectious disease. And we can also start thinking about types of allergies or other things going on, other maybe autoimmune diseases. In the United States, we see lots of allergies. We also see quite a bit of autoimmune disorders, a plethora of different things, right? And if we look abroad in some of these developing countries, those incidents are considerably lower, all right? In some, like Africa as an example, peanut allergies are virtually non-existent. We don't think about that type of stuff, all right? But here, it's a huge issue, all right? You want to, have cookies or anything like that you're taking into a classroom or anything, better not have, peanut butter cookies. Some kid's going to have an issue, all right? All sorts of things, all right? The nursing building right over here, there are signs on every door going in there that says somebody in there's got a severe latex allergy. You don't know who, they're not going to tell you who, but they're like, please don't bring balloons in here. No latex gloves, none of that, right? That's an issue, all right? And it makes me step back with something like that. I'm like, what about latex paint? Is that an issue? I have heard once it's dry, then technically it's not, but what is it? Could it be? If you've got a severe allergy, I don't know, all right? Weird, all right? So could there be something behind this where we think about being in a highly sterile or highly clean environment? This hygiene hypothesis, basically, the idea is where you're living kind of in this bubble, your immune response is relatively idle. And that sets the stage for it to kind of get tasked with other things, like picking up different allergens and saying, oh, we can do something against this. When if you were potentially dealing with something else that's truly tasking your immune response, it's too busy to think about this peanut or whatever as causing a serious issue, all right? So I truly don't know as far as, having maybe a parasite in your gut confers these types of benefits, but that's some of the idea, all right? Maybe having something else that's bothering you, your immune response, helps to free you of this, all right? Hard to say, all right? There are numerous types of autoimmune disorders where potentially something like getting yourself some worms could alleviate those issues, all right? There is a show, I don't know if it's still on or not, it was on Animal Planet, Monsters Inside Me, that's all sorts of parasites, all right? They kind of ran out of stuff, and then it's like, oh, the doctor left this sponge inside. Well, that's not really, it's a monster inside of you, but it's not the same as tapeworms, right? So there was this individual in one of the segments that had some serious allergies. He had all sorts of seasonal allergies, whatever. He was also severely allergic to bee stings. Didn't know that till he got stung by a boatload of bees, all right? and started going into anaphylactic shock. As all of this stuff happens and he gets in there, they start doing some allergy tests to see what's this guy really allergic to. And there's a whole list of stuff. He does landscaping. He's in California. He's exposed to all sorts of different pollens and things like that. Nice warm environment, right? Probably the wrong job, right? So he starts getting treated with all sorts of stuff and spiraling downward as the treatments really aren't helping, right? He sees his health going down. Puts on a bunch of weight with some of the, drugs that they're treating him with. Not so good, all right? And he catches wind of this idea that maybe getting yourself a parasite could be a benefit, all right? In the US, you can't just, technically there are ways. But right now, the idea of going to a doctor and saying, I need you to give me worms, it's not gonna happen, all right? So he took it upon himself, flew to the middle of nowhere, Africa, visited a bunch of tribes that do their business over here in this one area or this other tribe over there. And it's just this big open latrine, and barefooted walked through it for a week, all right? Which is impressive and disturbing. And the accounts of it, he's like, it's 120 degrees outside. The stench is enough to make you vomit, and I'm standing knee deep in it, all right? Awesome, right? And gross, all right? And he gives himself worms, all right? A handful of different types of worms he gets infected with, but really it's hookworms that we think about in his story, all right? So he gets these hookworms, and the hookworms start tasking his immune response. You can live with a couple handfuls of hookworms and not even recognize you got them, all right? It's when we get above that there's some potential issues. So giving yourself a dozen or so knowingly, you wouldn't even know, all right? Who knows how many he truly was infected with, but this guy cured himself of these issues, right? Cured maybe, all right? Doesn't have, hay fever or the allergies, all of the pollen and all of that nonsense that was drilling him, didn't. I don't know if he would willingly let himself get stung by a bee just to see what's up, but my gut says he's probably not going to mount as serious of a response as he did before, all right? Interesting, all right? I have heard definitely of other like autoimmune disorders where potentially treating with something like that alleviates the symptoms. Does it cure the disease? Probably not, but the symptoms are what's drilling you. And if you can alleviate that, there's really not that big of a problem, right? So I think the hygiene hypothesis is very interesting. And it's something, in the United States, we're kind of starting to think a little bit about some of that. Not that I recommend we all run out and get ourselves a buttload of worms, right? Probably not the best idea. Okay, shifting over to our next type 2 hypersensitivity reaction. We think about, there's a couple of things we think about in here, but the first bit is a transfusion reaction. So we've mentioned a little of this stuff as we've been working through this chunk of material in the first place. We've talked about our proteins, the MHC1s and MHC2s that allow for immune recognition and surveillance of our normal cells. And I mentioned our red blood cells don't have a nucleus. They don't have the MHC1 proteins. And that in turn opens up the avenue for blood transfusions without being a perfect match. You're okay, all right? You can't just give, for the most part, you can't just give blood to anybody and expect that there's not going to be an issue. We'll talk about who you can give to in 1 second. I think it makes sense as we're looking at a little of this, all right? So you don't have those class 1 proteins on your surface, but you got some other stuff going on, all right? Some glycoproteins, some sugar protein combos on the surface that lend as signatures for these red cells, but not something that's the same as the MHC1, all right? So on our type A person, there are A antigens, these proteins. The type B has B antigens, and the AB person has both A and B antigens. And this image up here with the 4 blood types and the details with the AB as we look at it, this is in biology, we would call this multiple allelism. There are multiple alleles within the population. You only get 2 copies, all right? But there's more than 2 copies out there, all right? This is also an example of codominance, where both of those alleles are expressed and both proteins are shown on the surface of protein sugars are shown on the surface of that red cell, all right? We also see dominant and recessive with the A and B alleles being dominant to the O allele, all right? So there's a handful of different things that are potentials up here, all right? So the O individual, we see little spikes on here, but there's no shape. There are no sugar combos being expressed on the surface of the O individual. They're lacking it, all right? So that's what's on the cells, or not, if you're O. Circulating in the plasma where the cells are antibodies, and there are antibodies dependent upon who you are, potentially antibodies against other blood types. A people have anti-B antibodies, B people have anti-A antibodies, and the O people have both anti-A and anti-B antibodies. The AB person over here with both of the antigens, they secrete neither immunoglobulin. They don't have any antibodies against this, all right? So with that said, all right, the AB individual without any antibodies, they can get blood from anybody. They are called the universal receivers. Doesn't matter what your blood type is, you can give your blood to an AB person. There are no antibodies, all right? We'll talk about the positive and negative stuff in a second because that technically has something to do with this, all right? But not in this slide, all right? The O person with nothing on their cells, they can give their blood to anybody, all right? Because there are no antigens on their surface. So the O person is a universal donor. They can give it to anybody. But with both of these in their circulation, O people can only get O blood, all right? Universal donor, but as far as what they can get, it's only O, all right? There's potential issues with that. The Red Cross would like to see you, all right? They're gonna see me at 2 o'clock today, all right? This is me right here, right? And they're like, come on, right? So that's all good, right? Down below the antigens, we can see, I've already talked about that, all right? So dependent upon what you got going on, all right, you can potentially donate to others or not. AB people can only donate to other AB people, all right? They can get blood from anybody, but as far as who they could give their blood to, only AB people, because everybody else is going to have a reaction, all right? Because they got both of these antigens going on, all right? And, you know, we won't talk about blood tests and all of that stuff as far as, you know, thinking like paternity, but you technically can tell some of this stuff based off of your specific blood type or your parents as far as what's going on, all right? And the A or the B individual could have an O allele. They could create an O person, but an AB person could never do that, all right? They can't make an O person. Sorry, went the wrong way. So in a transfusion reaction, and those antibodies, that the potentials to be made in those individuals are made without ever experiencing the other blood type in the first place. It's just there as a natural immunoglobulin, as a protective mechanism. Probably, you know, over the course of evolutionary time, this thing has been generated and persisted to help protect us from the mixture of blood. So we've got a donor that's type A, we've got a recipient that's type B. From the get-go, there's going to be problems, all right? The A person with their A antigens gets injected into the B person has antibody against A, and when this happens, these immunoglobulins snag on to the A cells that were injected in. Hopefully you recall, we'll ask right now, we should ask the people tuning in from home, but I know they don't want to talk. What immunoglobulin are we looking at? What am I pointing at? This big pentameric. No, I'm not what kind. What class? There's all sorts of different letters, right? We talked about IgE with the allergies. M, yes, I heard it there, and somebody else over here, I think I heard an M. IgM, the big one, right? The ability to snag like 10 different things. It's super important when we think about something like an agglutination reaction, because it's got the ability, look at this one right here, snagging all sorts of them, all right? So this, as we see them clumping up, this is a hemagglutination reaction. It's a clumping of the red cells. And it's something as the result of being injected with the wrong blood type. You would hope if you were laying in the hospital needing a blood transfusion that this crap didn't happen to you, right? They should know and take your blood and type it and do a cross match to ensure what they're going to inject into you is not going to cause a reaction. They should do that, all right? And if not, this could be the result, right? As all of this gets linked up, remember IgG and IgM have the potential to stimulate complement. Complement gets activated and destroys these complexes. You hope that's happening too to clear up all of these issues. But if you're getting a whole unit of red cells, that's the wrong, that can overwhelm your system, all right? But complement should recognize and deal with some of this, all right? So dependent upon the circumstances, this is what we would see, all right? I mentioned the positive and negative stuff, all right? This is called an Rh factor. A rhesus monkey was the first to have this detected on the surface of their cells, and come to find out lots of things have this marker. Your red blood cells have all sorts of things on them besides the A antigen or the B or whatever, or the lack of it, maybe an Rh, all sorts of other things, all right, that are on there. We're not going through all of those details. You're not sitting in a hematology class, but there are definitely other things, all right? When we talk about blood donation, knowing your specific letter and a plus or a minus is what we care about. But if you were going to do more than donate your blood, maybe you're going to donate some bone marrow. We want to know more details, all right? We want to know all sorts of stuff that you potentially have as markers on your cells, some of it being that MHC1, but other stuff as well, all right? And the closest we can get, we're good to go, all right? So with this, the Rh factor is important when we think about the mother, all right? Back in the day, if love was in the air and these two individuals decided they were going to get married and they were going to have a kid because that was how things happened, right? Today, that doesn't matter. You don't have to be married to have a kid. You don't have to go to the courthouse and get permission, right? But back in the day, it was a little bit different, and love is in the air. You go get, we're going to get a marriage license. You get a blood test first. That blood test basically says, are you two compatible? Basically, if she's a negative and he's a positive, you're not compatible. And they will say, you shouldn't get married, right? I think about that and I'm like, if love is truly in the air, do you think that person is going to deter these two from whatever is going to happen? Probably not, all right? And that's where we get some complications. That's why they were trying to say, probably shouldn't hook up, right? Probably shouldn't, right? So this is like an allergy, all right? Kind of the same sort of an idea. The first exposure isn't the problem. It's the next exposure that gets you, all right? And I think, you know, thinking a little bit about some of this and what's happening, we definitely could maybe think of some of this as being a catalyst for some infertility issues that we may be seeing, all right? Possibly. So in this case, we've got a negative mother, a positive baby, all right? The mom has two alleles that are basically lacking those proteins. She is a negative. The father, and this is simple Mendelian inheritance. The father could have one positive and one negative allele or two positive alleles. It doesn't matter. As long as you got one of them, you're positive, all right? So he happens to donate that one positive allele to the child. Now you got a positive child. Upon delivery, there is the potential for the mixture of the blood between the fetus and the mother, and now that's the sensitizing dose. She gets this first little shot of positive blood and produces antibodies against that. The next pregnancy, if it happens to be a positive as well, that's when the issues happen. The antibodies and the memory cells are like, wait a minute, I've seen this before, and this is foreign, this is bad, we should destroy this, all right? And if it doesn't get destroyed, there's some serious issues when this child is born. You can survive, all right? But there are some serious issues, and hemolytic disease of the newborn is pretty disturbing, all right? If you like seeing all sorts of nasty images, Google image some of that, and you will probably wish you didn't, right? Not so good, right? And basically her immune response is trying to destroy this child. A quick and complete blood transfusion for children that actually survive and are born living need to have a blood transfusion immediately or they will die, right? As all of their red cells are being clumped together by her immune response, right? So the IgG crosses the placenta, that's what's, and we show just the little Ys, not the big pentameric IgM, it doesn't cross the placenta, all right? So that's the issue, all right? If she has a negative child, that wouldn't be a problem, all right? There wouldn't be any of those markers on that child's cell, all right? So it's the negative mother that's the potential issue, all right? There are drugs that can block this from happening in the first place. It's called ROGAM, and ROGAM basically makes it so that the antibodies don't get created and subsequent pregnancies are basically like the first pregnancy. There are no issues, all right? So there are definitely, I think, some potential concerns. Females could be pregnant and have a miscarriage and not know what was going on in the first place. What was the blood type of that significant other? Who knows, right? Maybe you know, maybe you don't. But if she was negative and that child that miscarried was a positive, she has definitely been sensitized and potentially unknowingly, all right? If she never goes into the clinic to receive some ROGAM basically immediately, the damage is done, all right? And subsequent pregnancies that potentially result in the positive baby being in there, her body will attempt to destroy, right? And I think there are definitely some circumstances with females that have multiple miscarriages. Potentially that's really the issue, and they may not know that's really what's happening, all right? Hard to say, all right? So there are other issues besides just your blood cells. We think about organ transplants and other stuff with those type 2 that can cause similar issues. Like I said, we want to know more about what's happening, right, on your cells. The type 3 hypersensitivities, these are immune complex disorders. So it's back to this type of stuff, all right? When we start grabbing and making, taking things out of commission, maybe not our red cells, but other stuff. And complement should come in and it should destroy stuff. It should kind of mop it up, if you will, and alleviate all of these big clumps of whatever. If we think about other antigens, soluble things that get clumped up, that's when we start moving over here, all right? We're not looking at red cells, all right? We're looking at other things where these immunoglobulins have grabbed the respective antigens, complement, you would hope would just destroy and alleviate this, but that's not what's happening in this type 3 hypersensitivity, all right? The immune complexes in this case can get deposited in various tissues. That's what we're showing here. It looks like all just a whole bunch of the same cells, but it's not. It could be any of these that serve as the potential, all right? So the complexes deposit in tissues, complement can get activated, but at this point, now there's problems because these complexes aren't just free floating to be destroyed in the circulation. They're glommed onto these tissues, whatever types of cells, and now complement's destroying those cells as well. That's a big problem, all right? Potentially huge problem, all right? So we see inflammatory responses. You can see the cell destruction as we move through here. Neutrophils come in and they are good at destroying things, but in this case, it's our own things that start to get destroyed. And we see all sorts dependent upon where it's happening. Vessels, heart, joint, skin, or kidneys that are getting impacted with these complexes. And in lots of these issues, it's multiple body sites where we're seeing these problems as a result, all right? So in this case, with the last bit, with the kidneys, one example of this could be strep throat. Streptococcus pyogenes can cause all sorts of issues besides a sore throat, all right? And it truly is important to recognize what's up and start to treat it. Not every Streptococcus pyogenes, not every strep throat has the likelihood of generating these types of issues, but some of them do. And if they happen to have the proper antigen, that can stimulate these circumstances. If I remember correctly, I think the bacterium needs to be infected with the right type of bacteriophage. That bacteriophage stimulates the production of the specific toxin, and now we've got problems, all right? So scarlet fever is a potential, rheumatic fever, glomerular nephritis, that's the kidney issue, all right? And the complexes get in and cause massive destruction of the kidneys, destroying the glomeruli, and in turn resulting in the patient needing dialysis. Basically, they're on a kidney transplant list. And in this process, removing, as we're dialyzing, we're removing blood, purifying, removing all of the impurities out of it that the kidney should be doing, and injecting it back in. And again, depends definitely on the circumstances as far as how or where these complexes could be targeting. This next one, this is a type 4 or delayed type hypersensitivity reaction. The first group, the first 3 hypersensitivities that we've talked about are what we call the antibody or humoral mediated response. We've got all sorts of different immunoglobulins. We've got B cells that are pumping this stuff out and recognizing one way or the other, right? Depending on what's stimulating it. This is different. This type 4 hypersensitivity is a cell-mediated response, not an antibody-mediated response. So you see in here these T cells, right? It's the T cells stimulating other cell-mediated helpers, cytotoxic T cells, macrophages, not B cells, right? And it takes some time, all right? It also, like an allergic reaction, requires a sensitizing and shocking dose, all right? Poison ivy, something around here, relatively common, probably things we have all brushed up against, maybe, all right? I want to tell you a story. I think it's pretty impressive. And as I was being told this, I was just like, oh no, right? You poor thing, right? So we have a friend that from here, she moved to Oregon. She's living, well, Oregon's lush and green and, you know, some parts, right? Western Oregon, not so much, lots of sagebrush, right? So she's got some friends that are like, oh, let's go hiking. There's this beautiful trail, whatever, we want to show you around, right? Here, let's go, right? So she's hiking with these friends and she hikes through this bit and they all kind of stopped and just looked at her and they're like, you know, you just walked through a bunch of poison oak, right? I couldn't tell, you know, we all probably would like to say, oh, I know what poison ivy looks like, right? Maybe you do, maybe you don't, right? Poison oak, I don't think I would even know, right? I probably would do the exact same thing and walk through it, all right? And as I'm looking at this poison ivy, I'm like, I don't know, right? Would I know if I was hiking? Probably not. I'd be too busy, you know, not watching, right? And you know, you're hiking in shorts, right? So your legs just brushed all through this. So she calls us up and tells me about this and is like, hiking, walked through this poison oak, nothing happened. I'm immune, right? And I laughed and I'm like, I don't think you are, right? I bet you've never seen poison oak before in your life, right? I bet you're not, right? She doesn't listen to me, right? Why would she? I'm not that kind of doctor, right? And in turn, a little bit later, week or so later, they go on another hiking trip, different spot, right? She walks right through this poison oak. Why? Damn hell, she's immune, right? This stuff doesn't hurt me, right? Yes, it does. The next time was the shocking dose. Her first experience, she was immune, right? She's immortal, right? This stuff won't hurt me. And when she called me the next time from her couch, right, with a severe, because she just walks right through this stuff, right? Poison oak doesn't hurt me, right? Yes, it does. I think there are potentially some that things like this may not cause issues, all right? There are potentially some. She's not one of them, all right? And in turn, this image right here, her legs were just covered with these severe fluid-filled welts. She couldn't get off the couch for a couple of days. Not immune, right? And when she called me the second time, she's like, you were right. Yes. Okay. So in order for this to happen, you get exposed, these dendritic cells see it, they show it, and we produce some memory cells. This is the first exposure. The next go around, we brush against it, and those memory cells are like, wait a minute, right? We know what's up, but it doesn't happen like that bee sting, and it's an immediate reaction, right? It takes time. It could be a day, maybe a little bit longer, all right, for it to truly give you the good welt, all right? So, and that was also something that she was pretty sure she was good as she walked through there. And she's like, yeah, nothing happened. I walked right through it, right? But the next morning, oh yeah, it's not, all right? So you never know, all right? I recommend if you are going hiking that you kind of know what you're doing, right? And don't expect that you're immune, right? Because you're not, right? All right, this, I will leave you with this. We'll mention this. This, another skin test, not for poison ivy, but it's a similar idea, thinking about tuberculosis, similar sort of reaction. It's a delayed type or cell-mediated response. A TB test doesn't show up the minute they inoculate it under your skin. It takes 48 to 72 hours before you truly say, you're good to go, right? Not this specific, this is, yeah, they don't use this, but similar idea. And you hope that doesn't happen, right? Okay, we'll pick this up Wednesday, guys. Have a great day.